I can always go.
I'll go next.
Okay.
First, I'm not quite sure how, I can't express in fully at this point with all of the things I've learned over the last 2 days. That's the full range of appreciation that I have for the organizers putting this together and for the ILO convening this group and for this opportunity to learn what I have learned in the conversations today. Let me focus on 3 areas that coincide with our work that crossed over the things that I heard over this last 2 days. We work on universal health coverage. Ariel Pablo Mendez and the colleagues at the Rockefeller Foundation working together over the last several years have given this a special boost in the global community. And I'd like to cover a couple things about UHC. Second, about metrics. Ariel has pushed us to worry about measurement in ways we had never considered before, and we're going to have a summit on measurement early next year, bringing together colleagues from many of the organizations around the table. I'd like to say a few things about metrics. And then thirdly, a little bit about service delivery and some things that I gathered out of that to talk about some of the challenges and some of the best practices I heard. First, back on UHC. In my opening yesterday, I covered a number of the key pieces of universal health coverage as we think about them now. It has to be the case that in almost all the things I've now dealt with over the last 5 years working on UHC with Ariel, I don't think maybe once or twice only did we mention the informal worker as an explicit piece of the concerns there, even though very clearly from what I heard all through these 2 days, they were there all the time, and their invisibility in many of the things that we've been putting together, it seems to me, has been causing us to perhaps misunderstand opportunities or miss them, and probably to misappreciate where options might be present that we were not picking up on. Certainly a large portion of the service coverage concerns that we have are those that are represented by the informal worker and informal workforce that we've just been talking about. I can appreciate a number of areas in which we can think of possibilities for moving forward in giving a new boost to resolving some of the challenges that are facing countries and trying to move to a wider coverage of basic services, of the essential services as we talked about them. I mentioned yesterday, and I'd like to underscore here again, that there are a number of technology fixes that have been used lately in especially using mobile technology to help, including with informal workers and informal workforce, get access to both data on the one hand and provide information, health education, and promotion material, and also to deal with the mobile money, using the mobile money technologies that provide us an opportunity to jump over, leapfrog over really a lot of legacy technologies, deal with accountability and transparency and important matters related to money that are a part of the financing side of the matter as a whole. It seems to me that all the way around is the UHC area has a lot of important things to give attention to now, and I pledged to the group here to bring them back to the several ways in which I'm involved with the UHC movement as a whole. Second, with respect to metrics, the USAID and its partners have a long legacy of investments, a fairly large portfolio of investments related to measurement, the demographic and health survey work that Peter got us started with in the development of health accounts, and now a wider range of metrics related to the health sector, a wider range of them that for the most part don't give that much attention to the informal workforce as a part of the key metrics to be given attention. And I can see where in a number of ways in data linkages and in pulling together data sets and in the definitions and questions that are a part of our various surveys, we're missing an opportunity to give attention to those, and I appreciate the conversations here for giving those a boost in attention. There are a number of parts of the family health situation that we pick up as a part of our survey work, which I think would be enriched and would be a better guide to many aspects of policy, both in service delivery and in various things that are causing people not to have access that would be improve by our making clearer in the way we collect our data how those things work. There are a number of metrics matters that it seems to me that would be improved as a part of that programming that we're involved in. And I will see how we can make our summit give better attention to that as a part of the work that we'll be doing this next year. Third, with respect to service delivery and the various things at the community level and on up that we've talked about yesterday and today. First, salute to WeGo. I had known about WeGo. I am totally impressed and excited to learn more about the ways in which these community level activities and on up to deal with community leadership and municipal leadership. You've been able to make progress in a number of countries where I'm appreciating the challenges must be huge. And the way in which that work has moved forward as a grassroots and activity that's made the progress that we heard reported in this discussion was very enlightening. Ways in which public-private partnerships can work down through to community level activities as a part of that service delivery, service arrangement became clearer to me. Some of the clarifications that others had pointed out that Derek pointed to, ways in which the why were involved the informal worker and give it attention that were suggested by him and by some others. It became clear to me, and that was a big help to me as well. So those are my main points, I think.